Well, good evening, everyone. This is Dr. Ellithorpe from Tustin Longevity Center here in Southern California, Tustin, California. And we are meeting every Tuesday at 6 p.m. This is Ask the Doctor Anything. It's a program that we do for educational purposes to try and give you an idea what a functional medical doctor would do to try to answer questions of healthcare and prevention, maintenance, things like that. It's not meant for medical advice over the YouTube. This is meant for, indeed, just getting an understanding about the experience that we have had over 45 years of practicing functional medicine long before any of these YouTubes came out. I'm very happy to see these YouTubes coming out with the younger doctors talking about these things that we've put into practice so long that showed efficacy, that stimulated their interest, and we're now finding that the specialists and functional doctors in these various specialties like gastroenterology are producing finally some research in neurology, producing breakthroughs in neurological functional care protocols, and many other areas. I think this basically started largely with the exacerbation over how to treat psychiatric illnesses. And one of the influencing books and doctors that I was having the pleasure to read and to learn from in my, after medical school, I did another postdoctorate in integrative medicine at Capital University of Integrative Medicine. It's now closed down. Why? Because of no financing. It lasted from the late 1990s until I guess, maybe 2010. It should have tried to hold on longer because that's when really all the excitement burst through and the publications validating all the work of the doctorate of integrative medicine that they were giving. But we learned from some of the greats from Europe and Eastern medicine and Ayurvedic medicine, all these various methodologies that are never ever exposed to any of the Western standard medical allopathic training. And we try and bring this to the forefront here, available to you, the public, our friends, our family, our patients, so that you have an access or a place you can go once a week to try and give me your questions. So you can type in a question here on the YouTube chat. That's open. I see we're starting to get some questions coming in. And then I get these email questions. You can get that by going to tlcdoctors.com. That's our website, tlcdoctors.com. And then there you can get onto our newsletter, mailing list, or email list. And then we'll give you a notification reminder that this is going to be taking place. We do it every Tuesday from 6 p.m. to 7 p.m. If this is a help to you, a blessing to you, please like and subscribe and refer to friends or family. We will start with the live questions, and then I will go to the email questions. So as usual, I'll be doing my workout right afterwards. On Tuesdays is when I go out to do my weightlifting with my husband. And so I'm in my workout attire as usual. And when you see me wearing it, you know that I'm on my way to the gym right after the program. So wonderful. The first question from our live audience is from Mogwai. I'm not sure if I'm saying that right, but they say, "Hi, Dr. E. I'm a 37-year-old woman who struggles with high LDL and low HDL cholesterol. What is the best supplement to help improve HDL?" The best supplement to improve HDL is supplementing your activities with weightlifting and going to the gym 2-3 times a week, because exercise is probably one of the best stimulants to bring your HDL, high density lipoproteins, up into higher, more protective levels. And there's just a tremendous amount of benefits, not to mention building up your muscle mass, because at 37 years old, you are at the cusp of building the maximum amount of muscle mass you're going to ever have in your life. And then you start losing it from there on, unless you start doing weight training and doing resistance training with lifting weights, as I will be doing here very shortly, within the next hour. And then the other thing is I'm going to suggest the clinician's preference oil. That contains in it the linoleic and alpha-linolenic acids that are produced so that they will not become rancid. Fish oils will get the name and the claim, but if you really understand human physiology and fat metabolism, it is linoleic acid that is not oxidized that is so essential for cell membrane health and longevity. In fact, I think it was 1929 when it was first discovered by Professor, what was his name, and his wife. But anyway, these two biochemists, in the great explosion of nutrient research, was in the early 20th century. In 1929, a male and female married couple, biochemists, did animal studies, and they denied the animals all the fats. And then they saw the illness and death rate of the animals. And then they started adding the known fatty acids back in. And when they found linoleic acid, they said that this is an essential fatty acid, of which there are two. Linoleic acid, that's an omega-6. That's the one you hear about all the time where they say, oh, this is terrible for heart disease. But it's not. What is terrible for heart disease is when you take linoleic acid, which God made abundantly in the animal, fish, turkey, chicken, beef, egg yolks, nuts and seeds, and some plants, made it abundantly available because we need a lot of it for all of our cell membranes. All of our cell membranes, our 40 trillion cell membranes, need this to have soft, pliable membranes. And that linoleic acid is not oxidized and is essential for the cell membrane function, receptor, holding them in place so that a multiple docking on the cell of various receptors to get their messages for cell function are received. Now, what happens is they, in food industry, corrupted the food system with seed oils, which are rich in linoleic acid. And when they bleach it and boil it and heat it, they fracture them and they make them hydrogenated fats. These hydrogenated linoleic acids are what are in all your popcorn and your corn tortilla chips and your cereals and your breads and your bagels and your pastas and all that. And that's what's very harmful for heart disease. Now, that's just a bonus statement there. So the number one thing is get out there and exercise, build up your muscle mass for your aging and development. And then the oils that are the right ones to eat are the non-rancid or non-oxidized clinician preference oils, which we have here at Tustin Longevity Center in our supplement department. Anyway, that's what I would recommend. Now, LDL, that is what I call the other good cholesterol. Now, most doctors kind of just follow the masses of the herds and they call it bad cholesterol. But LDL cholesterol is very, very important. It is just a protein-sized type of protein carrier that inside has the fats that are non-water soluble. The protein exterior has a water-soluble surface, so it can float through the body. Excuse me, and it carries the fats to all the cell membranes and repairs areas that are damaged and hurt in your body. So LDL is what we call the other good cholesterol. At Tustin Longevity Center, we love cholesterol. In fact, we want all our patients who are 70 years old and older, like myself, to have cholesterol levels that are higher total cholesterols than the 200s. And we don't mind elevated LDL cholesterols. Now, why is it a good cholesterol? Because if our cells are all made of fat and protein, they've got to have fat, and you have to have carriers to bring the fat to repair parts of your cell membranes throughout your body. Because if you injure, and you're injuring them every day of your life, so if you injure them, okay, like this is a blown out part of the cell membrane, you have to have a mechanism where you can repair that injury. So you have to have an LDL particle floating around looking for any injured cell throughout your whole body. So we love cholesterol. We love LDL, the other good cholesterol. The other thing about it is that your stomach takes in foods, especially with the high sugars that we consume, carbohydrates and fruit sugars in our society. And all that sugar is feeding bad bacteria all along our gut. That bad bacteria makes lipopolysaccharides, which are very threatening. If it stays inside the tube and is pooped out, we're good. But as you realize, the lining of your gastrointestinal system is one cell membrane thick. It's only one cell membrane thick, just one cell membrane thick. And if you injure it with a food lectin or something, what will happen then is that'll create a hole that needs some LDL cholesterol to deliver repair fats and proteins to fix it. And otherwise, those bad bacteria in your gut will leak through that hole, and that'll get into your blood system and lymphatics, and it will create inflammation, which will promote heart disease. So, no, we know the truth here, and we don't need bought off medical school training that just pushes something superficial so doctors don't understand really how to help their patients. We love our patients to eat healthy fats, the saturated fats, the meat, fish, chicken, turkey, beef, eggs, and egg yolks, and the corrupt influence of the lobbyists on our misguided representatives. They buy them off so that we get sick. We eat these high carb junk foods. And with those junk foods, we feed the bad bacteria that increases the lipopolysaccharides. The junk foods have lectins that scratch our guts, and then it leaks through. We get inflamed. We become diabetic. We get obese. We get heart disease. We get autoimmune phenomena through the leaky gut. And so LDL cholesterol can actually absorb these lipopolysaccharide endotoxins that are produced, and becomes a sink to absorb any of this that might, even in a healthy person, get through occasionally. But when you just progressively don't care about what you're eating and you eat the high carb standard American diet, then it's just going to circle and amplify, and you will get all the chronic metabolic diseases that are now plaguing about 85% of all Americans. And unfortunately, even into newborn infants, we're seeing insulin and blood sugar metabolic syndromes and toxins from pollutions in them. So we're in a sad mess, and we better get educated. So that's why we're doing this, to help you realize you can clean up your life, you can help your children, and you can live healthier and vibrant without any medications, and get in your 70s and not have any joint pain, and not need hip replacements, knee replacements. You don't even need a marital replacement. You can learn to be happy and live with the same person, and learn to improve your own behavior and self as your spouse and you help. Iron sharpens iron, and then you can learn to mature and grow up and change your own faults. All right, so here we go. That's that question. Then we have another live question. Aneta says, as a 70-year-old healthy senior, there you go. And there's increasingly returning more and more of us because so many people used to be very healthy when I was a young doctor practicing in the 1970s. But 70-year-old healthy senior, how do I know how much weightlifting do I need to do? For example, how heavy a weight, how long when I am working out, and how many times a week. In general, if you go to a gym that has all the machines and they have free weights, I do not recommend free weights if you're not trained and have been using them all your life to learn how to use them safely. Instead, anyone starting to go into weightlifting needs to do this on the machines. These are big machines in a line. Usually they stack them up, and the machine will have this weight pulley system, and you put a pin in for the resistance that you feel you can handle. So you discover it on your own. You sit in any machine and you put the pin in, maybe at a 1, 2, 3, 4, 5, 6, 7. I think they go down to like, you know, 20 little sticks of pins into stacking up the weights that you'll lift with moving the levers and stuff. Just find what works for you so that you can do a slow, push out for the chest press, slow and return it nicely. And then if you feel like that's a good number and you can knock out slowly, 10, 20, 30, 40, then if you're doing it that well, then maybe you want to go to the next pin, a little more resistance, and maybe you can only do 30 of them with just a little added weight. So you work it out yourself, Aneta, on each machine. So the minimum I do work out, I'll be doing 7 machines. I don't know all the names of it, but you pull this down and you do the abdominal crunch for your core strength. And you put in the pins to the ones that give you the strength that you feel. I'm doing this under control and I'm releasing it under control. And I'm not getting here and going, oh my goodness. And then I let it slam back. Then you're working with too heavy of a weight. If you can't control the weight, both in contraction and relaxation, if you can't relax, returning it to its position, you're using too heavy of a weight for you. So work it out yourself. So you have the abdominal core crunch, then you have the chest press against resistance. Then I do the pull for my back muscles against resistance. And then I do the deltoids. I pull it down from above. And then I do the leg press. And then I do the leg extension and then the leg flexion. So that's all 7 that I do. And I spend about 3-4 minutes on each. Times 7 is 21 minutes. And I try and do another 2 or 3 in my half hour that I do 3 times a week. And again, don't do it without drinking enough water. Drink your water. And then that should be the way to do it. Now, Aneta, you could go for training for a month to a gym. You could hire a personal trainer there so they could look at your posture, how you're doing it, and give you some help and coaching. I think that's reasonable, and that's what I did. I used a place, however, called The Perfect Workout. The Perfect Workout. They're all over the place here in Southern California. You can just say The Perfect Workout on Google or your search engine and near me, and it'll show you a place. You go there and they put you on like 5 or 7 machines, and they start teaching you about your posture, the way you're holding, gripping, and they give you a guidance on the weight that is safe for you, and they go from there. Okay, how much time each visit to LA Fitness and how many times a week? Well, I would say at least 20, 30 minutes per visit. And I would say 3 times a week with a day off in between. That way your muscles can recover and you're doing your whole body, your upper and your lower at the same time. That's how I do it 3 times a week. I do it 30 minutes. That's an hour and a half. Then the other 4 days a week, I'm trying to do a very fast paced walk. I have my dog and I have my family I walk with, my grandchildren. So between that, so if you do, they say total about 150 minutes a week would be the minimum. So I've got in 90 minutes so far. So I'm looking for another uh, uh, 60 minutes where I'm taking a long, hard walk, probably 2 half-hour long walks or 3 fast 20-minute walks a week. So I'm getting at least 150 minutes per week, uh, an hour and a half of which 90 minutes is my weight resistance, and another 60 minutes is my vascular work, aerobic work. So she says, I'm trying to schedule a time with a trainer at LA Fitness. Thanks. I will walk a half hour per day, fast walking. Yeah, that'd be great. And then add in your weight training to that bedrock. If you can walk every day, and I try to take my dog on a very fast walk every day. But the bare minimum is a 20-minute fast walk at least 3 times a week to get my 150, because sometimes other family members walk our dog and, then she gets her walk. Yeah. So, we have to do it. And so when you work with doctors or healthcare providers, you have to work with them in a way that they're going to be excited for you. They're going to be encouraging. They're going to be looking at your lab and showing how that lab will affect your HDL. That lab will lower your triglycerides. That lab will bring your blood sugars down. If you do this exercise and overlay it with not eating late ever, especially if you're older, and you eat a richer carbohydrate, a richer protein carnivore diet, because to get those muscles being built, you want to eat much more protein as you get older, almost like you're a carnivore. Like before I came here, I got home at 4 o'clock. By 4:30, I was eating a big hunk of chuck roast meat, and I slow cooked that. I must have had maybe a half a pound of it. Yeah. And so in that, I probably got 70 grams, 80 grams of protein. I'm trying with my weight, I'm trying to do my lean weight in whatever my pounds of lean weight is. That's for every lean pound of weight, I want to do a gram of protein. So I'm trying to get about 120 grams every day to 140, because that's my lean mass weight in pounds. The rest is fat or some bones and stuff like that. Okay, let's do some of these internet email questions. Christine starts off with a very nice statement to me personally. I won't read it to you, but she's very kind and being gracious to me. Thank you, Christine, for that kind statement. Her question is, my diet is clean, lots of lean protein. You don't have to worry about being lean, Christine. You can eat the fattiest prime rib grass-fed beef you can. I try and get the fattiest grass-fed meat I can. I don't go for the leanest because I'm trying to get healthy fats, and part of that comes when I eat animal products. But she eats lots of lean protein, eggs, and cruciferous vegetables rich in sulfur, which has many nutrient values for your immune system, small amounts of berries, etc. But I'm having difficulty giving up sugary foods entirely. I have a couple of bites when I have a craving. Is this okay, or should I try to cold turkey it? Christine, it depends on your exam. What is your fasting insulin on a series? It isn't just one isolated fasting. We would like to do 2 or 3 to look at your history over the course of a year and a half. What is your fasting blood sugar over a year and a half? what are your triglycerides over a year and a half, and what is your hemoglobin A1C, what's your uric acid, what is your lean body mass, what is your triglyceride to HDL ratio. We want to look at things like that, and your age and how much exercise you're able to perform. Do you feel refreshed in the morning, ready to start the day? Your age, we need to know your blood type. There are so many other things we would want to know, because even the Lord has in the Bible, feast days. And on these feast days, it's meant to be a time where we can have food become entertainment. So, what has happened though, our system has become corrupted, and through marketing and the greed of money and the sin of that greed, we get all this marketing to us, and they tell us through our social friends, our family, our school friends, our work friends, even at church, we see the silly donuts there. And you deserve a break today, every single day. Every mother and their brother and their cousin, and anytime they have a birthday, a promotion, or a graduation, or an anniversary, or a party, everyone's eating and eating and eating and eating. And this ought not to be. So, if you have a good metabolism, we would calculate your HOMA IR, HOMA, capital I, capital R. You could do a search engine on that. HOMA IR. That's like a homeostasis insulin resistance, and that's your fasting blood sugar times your fasting insulin divided by 405. 405. And in England, on their metric system, you'd be using a different count. I think it's 22.4 you would divide by using the glucose and the insulin in England. But anyway, back to us with our fasting blood sugar and insulin divided by 405. And if that's greater than 1, you're insulin resistance. You are entering into the danger zone of chronic metabolic disease, be it diabetes, cancer, heart disease, Alzheimer's, autoimmune phenomena. And every doctor who's worth their dime should know about this. Therefore, make sure your doctor is ordering on you fasting insulin, fasting glucose, and you can calculate that yourself. And if that number is greater than 1, you're becoming insulin resistant. And then you'll gain weight, or you develop fatty liver. Even though you appear thin, you'll develop fatty liver. You'll develop maybe a cancer or one of these horrific chronic diseases. Please don't do that. So can you have some sugar? Sure you can. Do I have some sugar? Yes, I will, and I do. But I'm doing my blood work at least annually, if not biannually. I'm monitoring my insulin, my glucose, my triglycerides, my HDL. I don't care what my total cholesterol or LDL is. And then I get out there and exercise regularly 3 times a week. I take that brisk walk. I drink my volume of water every single day. I get my little body into bed into night time so I can heal all my little broken cells, so I can fix all those broken where is it? There it is. The holes that are broken in my aging body with the healthy fats and proteins. That's what I do. So yeah, have a little treat. Now there are those, however, and that is why I go on a fast January 1st. I kind of lose it on Christmas Day, and for about a week period of time, once I taste and I get that insulin spike, that'll drive my ghrelin and hunger and balance off, and I almost become crazy for sweets. So to discipline myself, I will fast for up to 5 days, just on a water fast from January 1st, the evening, all the way on to the 6th. of January. And I've been doing that many, many years to help me stay in shape. If I cheat, let's say I have a wedding of my niece or nephew, someone very meaningful and close to me, and I do have a treat, the very next day I will fast for 24 hours. Okay. So I play those kind of games with me because it works. You might not be able to respond that quickly. So you have to find out and work with your functional doctor to find out what works for you, how much exercise, because stress will aggravate your sugar metabolism. Poor sleep, just aging is a stress and difficulty for sugar control and metabolism. Your mobility, exercise level is a stress. Your work and demands will all have an impact. How well hydrated you are, what time you eat will have an impact on your blood sugar control. So let your good functional doctor help follow you and guide you in that. Let's see. Karina says, "Hi, Dr. E. How are you?" I am eternal. That's what I am. I know who I am in the Lord. I'm at so much peace that I know where I'm going. So that's how I am. Okay. No matter what my stresses are, I am so at peace with who my Savior is. Okay. I couldn't earn a bit of it. It's just a gift I have. Hope all is well. I just want to know about your advice for autoimmune disease, and is it treatable, specifically Hashimoto's and Graves'? I do not have any nodules and infection. Karina goes on to say, I am 41 and it is related to perimenopause. She's saying that as a question. Is it related to perimenopause? Is it also trauma related? It all started after my son passed away. Oh, I'm so sorry, Karina. Oh, what a stress that is. I am never the same afterwards. Back in 2021, of course. And so, Karina, I would say, God bless you and God strengthen you, I pray, and bring to you many mature women who will be a support to you. I hope you have some way of dealing with that stress through your family, your spouse, other children, if possible, through a church or a spiritual support system that you may have, or counseling with that, because that is something very, very significant, and that will upset your cortisol, and that will upset your immune system. The high stress of such a loss like that. That's why we give a free immune drip to any one of our patients whose immediate family member has died, because that's such an immune cortisol hit that lowers the immune system for any kind of breakdown of the tissue or infection or shingles or various things like that. So we try and give a boost of vitamin C immune drip with the B and the minerals and all that stuff with it. Yes, it is treatable. And Karina, I would find a good doctor functional, and I would honestly, I would go carnivore to heal that lining of the gut, all those cell membranes with the essential fats, phospholipids, and proteins to heal that. Get a good probiotic in, and drink plenty of water and start exercising. That's a tremendous way to help de-stress yourself. Have rules about going to bed. Try and get the electronics off. Try and get the light down, and get yourself up with the sunshine. I would certainly encourage you to go stand in the wet grass in the morning at sunrise for 2 or 3 minutes. That would be my suggestion. You will find that the thyroid antibodies to your thyroid peroxidase and thyroglobulin antibodies will all go down if you become a carnivore for about 3 months and then test it again. You'll see the improvement. I've never seen it fail me, really, unless the person lied to me and said they were carnivore, but they just cheated so much it was meaningless to claim that they were a carnivore. Mari says, my 28-year-old wife, a mom of 4, is in remission from Hashimoto's. She has heavy periods, possibly from past fibroids. Her doctor recommends an IUD No, no, don't ever use I never recommend intrauterine device. I recommend they are always removed because intrauterine devices work through the principle of inflammation, and inflammation is the enemy of the human body. Why on earth, in God's name, would anything like that be introduced? Can only come out of the most evil pits of thinking in the so-called healthcare system, and only that would happen to dear women. I would never imagine a man having something shoved up him to create chronic inflammation. It would be just incredible. So no, no intrauterine devices. Yes to progesterone, and take the progesterone day 15 through 28 of the cycle is what I instruct all my perimenopausal women to do, and find out her blood type. And if she's blood type A, get her on digestive enzymes with every meal. Get her to see a good functional medical doctor that can look at her hormones and her thyroid antibodies. And then I would imagine they would tell her to do a carnivore diet. We can do immunofood labs to see what foods she's learned to become reacted to. But she has to understand, everyone has to understand, you eat your way into disease. So she ate herself into this problem, and everyone is in America and is hurting the lining of the gut. And that gut lining is only one cell thick, and food, plant material largely from plants, has lectins and oxalates and phytates and plant tannins and so forth that are associated with harming and scratching and poking holes, like you see here in the cell membrane, poking those holes that will allow the leak to create the inflammation that very often is targeted to the thyroid. And if you shut it off by becoming a carnivore until you're healed, usually that takes 3 or 4 months, working with a good functional doctor, and then they can talk about reintroducing a limited and more controlled diet. The American system is going to harm our children. It already is. And you can see this from here. And so just find a good functional doctor and get her there. Okay. Maury goes on to say, physical and post-pregnancy stress. What holistic strategies can support her health and minimize stress during pregnancies? 2 of 2. Well, I look at my females who have just given birth, and I track their thyroid function very closely, because hypothyroidism is very common after delivery, and postpartum depression is also associated with a drop in that. And I only use natural T3 from whole glandular sources. I will very often support with some estradiol and progesterone. Estradiol is a mood lifter, and progesterone helps you get a nice deep sleep and helps with cortisol control, for which I also give DHEA. And then I have them take vitamin D and get that vitamin D up to about 100. And I ask them to drink a ton of water, half their weight in pounds as ounces of water every single day. And then I demand that they exercise and do some weightlifting. That brings them out of this postpartum depression and this inflammatory stage. And I've really never seen it fail. So I would encourage you to find a good functional doctor who will look at DHEA, estradiol, progesterone, testosterone, cortisol, her free T3, her TSH, her fasting blood sugar, her fasting insulin, her fasting lipid triglyceride to HDL ratio, and her hemoglobin A1C, and maybe even a fructosamine and a uric acid. All those need to be done, a good chemistry panel, a good blood count, probably an iron level to see if she has enough storage iron to make enough iron, and do those things. That's what I would do, and God bless her, and let us know how she's doing. Karina goes on to say, I did carnivore and went lion diet, but then experienced oxalate dumping. Thanks so much for the advice, Dr. E. It is by God's grace that I'm still going. Praise God. Yes, Karina. Amen. Oxalate dumping has a limit, and I would still do it, Karina. I'm not saying you couldn't eat any. Uh, if you work with your functional doctor, and each case is unique, we will look at your situation and see if we can't help mitigate it with some other things. So Karina goes on to say, God gave us another baby after our loss. Praise God for that. God bless you, Dr. E. And God is so, uh, his ways are above our ways. His thoughts are above our thoughts. His thoughts are always for our good. And I just try, my Bible reading today was in Isaiah 53. And I was just so touched with the fact that uh, God Almighty said he was satisfied with the travail of his soul. Jesus Christ, my Lord and Savior, dying on the cross after being mocked and set up and for this and getting the government tricked into crucifying him. And without complaining, he didn't speak back. What a wonderful, wonderful thing that is. And God was satisfied with the travail of his soul. So when I think about the horrible sins I've committed in life and how that God should judge me and separate himself from me for them, and yet he can forgive me. Oh my goodness, I am I'm just given over. I am dead. I've already died to myself, and I live unto God, my commander in chief. And it's just a wonderful, free, loose way to live. So I'm so happy for you, Karina, that you have that comfort and just trust him. Some of us, he's going to let us go through the fire. Some of us, like Job, had to suffer such great loss. Some of them had to give up their lives. And we don't need to even know of how many dear people out there have given up their lives helping others for his sake. Anyway, I love that. And I can't find anything else that approaches that kind of a wonderful God. So Lindy says, God bless you. I'm watching from Spain. Well, hello, Lindy Navarro. Good to see you. God bless the Spanish. My sister, Linda, who is in heaven now, she went to Spain, to Madrid, to learn about the Spanish language. She became a Spanish teacher, Lindy. And when she's older than me, I'm the baby in the family. We're all girls. And Linda got polio. She was born in the mid 1940s, 1947, somewhere in that time. And with that polio, that kind of inspired my father to really just break free because he worked for Armor Food Research. And he said, I am going to find a way to help my daughter because my mom had lost 4 girls before Linda was born, and then Linda, Sandy, Debbie, and then me. So 8 total. And Dad took Linda up to Sister Kenny in Minnesota, where she did nutrition and stuff and physical therapy. She wasn't a Catholic nurse. She was an Australian nurse, and they're called Sisters in Australia. And my sister got these vitamins and stuff. My dad had not yet learned about Dr. Kenny's work or Dr. McClellan's work on high-dose vitamin C on children with polio that cured them, every single case they had. But she got enough vitamin C that the polio only got to her right arm, or maybe, no, it was her left arm. That's right. And she had a slurred, like a drooping face and tongue. And she chose to speak Spanish because she had a bit of a lisp, trouble enunciating her words. And her 8th grade Spanish teacher, because they taught Spanish in grammar school in our little country school, encouraged Linda, and Linda became the greatest Spanish teacher. She served in the church's schools all the days of her life, had 5 children of her own, and she went to Spain and studied their whole culture. What a blessing, Linda, it is to see you here with us. Thank you for coming. Pam says, my daughter is 26 years old. She has not had a period for 6 months. She has stayed consistent with weight other than losing 10 to 15 pounds in June, which may have been with a trigger. What do you think? Well, it depends on what her mass is. There is a critical mass that a girl has to reach pound-wise, roughly, to commensurate her maturing into her hormones. And many gymnasts and athletes lose so much of their body fat and have such muscle mass that they become amenorrheic. So if your daughter is less than, 102 pounds or 99 pounds, it's probably going to be very difficult for her because hormones are made from fat, cholesterol. So get her with a good functional doctor. You can, wherever you are from, you can go to acam.org. And on acam.org, that's where they teach about chelation, detoxing. It was the very first functional medicine, integrative medicine, national grouping of allopathic medical doctors who said, heart disease is being helped with EDTA chelation therapy. I don't care what the cardiologists say. And they created this, the American College for the Advancement of Medicine. And now they got the tech trial done, trial to assess chelation therapy, which proved that we can cut heart death 50% if people can get chelated. And I'll defend that statistic to the last day of my earthly physical life. But anyway, so she has to get a good functional doctor, get her blood type, get her hormones, maybe give her some natural progesterone, and help her that way. That would be my recommendation, Pam. Get a body mass indice on her. And so Karina says, God bless. All the way from Sydney, Australia. Oh my goodness. I got to tell you, did you hear about your own country's Australian Bake Off? There was this Australian Bake Off, I think it was this year, the National Australian Bake. And the winning baked thing was a meringue pie this year. And that was so unusual for Australia, because when it was on the news, they were saying normally in Australia, they boomerangs. Boomerangs, get it? Ha ha ha. Well, anyway, hopefully that made you chuckle a little bit, Karina. Okay, and Pam adds in at the bottom here, she got to down to 115 at 5'5". Yeah, so I think she got to a weight that might be on the threshold. Karina says, ha ha ha. Well, wonderful. Okay, well, good for Australia. So got down to 115, Pam. So get a body mass indice, a BMI of her body, so we can get her true body muscle mass to fat mass. Let's find out about her natural hormone state. Remember, stress in these teenagers today is so much that it blocks the hypothalamic follicle stimulating hormone, and they wind up not ovulating. And without ovulation, the whole menstrual cycle gets off. So natural progesterone, you could buy it over the counter. We have the Kokoro. I've used that for 35 years probably. A natural progesterone cream over the counter, day 15 through 25 of the cycle. That helps. Eating a healthy, get away from all the processed foods and the packaged foods, and please just use natural homemade foods. Put it in your lunchbox or send it to school with her, and get her to drink enough water and see where she's at and find a good functional doctor. Let's see, we have another question here. Hayden says, 46-year-old female with low ferritin, that's an iron transport inflammatory iron stability kind of reference in the lab. The total iron is 88, which is acceptable. Ferritin is 14. That's on the low side. Iron binding capacity is 353, so it's up a bit. So whenever your body needs something, it makes more of the protein that's trying to grab out and get all the iron it needs. So the total iron binding capacity is up because it is looking for more iron. So that's fine. It's just she's saying percent saturation is 25, so that's low normal. I eat some red meat and a balanced diet. I take Thorns 25 milligram iron ferrous bisglycinate chelate. Sounds like it's a amino acid chelate. I would strongly encourage you to go and get sacred liver. What is the name of it's dried desiccated liver from grass-fed cows. And this is very rich in natural iron sources, so it won't constipate you or make your tummy feel bad when you're eating it. So liver pills, desiccated liver is very, very wise to do. We have Hemavite here. These are known iron chelates. You could use up to 2-3 times a day. But try and eat more red meat in your diet. Eat the liver. I love liver. I have bratwurst in my little refrigerator here, and I'll take a slice of liver pate or bratwurst, and I'll put it on a slice of raw cheese with a little mayonnaise on top. That's my lunch here. So I'm carb free pretty much, except for maybe some vegetables and yeah, you need more iron. You need more desiccated liver capsules. But the name of that company that I can recommend, I can't remember. It's Sacred Farms or something like that. All grass-fed liver products. That's what I would do. And find out your blood type. Because if you're a blood type A, you need to use digestive enzymes when you eat so you can extract the iron out of it. The next thing is from Juan, and he says, "Hi, Dr. Ellithorpe. Thank you for all you do for all of us." Well, you're God's creation, and I'm his servant, and that's what this is all about. I don't make any money from this. It's time out of my life, but it is investing into my treasure in heaven. There you go. Okay, so he says, my mom has been having heart palpitations for a little over 2 years now. She wore a heart monitor for 2 weeks and was diagnosed with supraventricular tachycardia. So that's the top part of the heart, the atria, not the big ventricle part on the left or the right. And it got fast from time. So supraventricular tachycardia, not sure if it was caused by the C shot. So she must have got the mRNA shot, which creates a myocarditis, which can generate these kind of aberrant rhythms. She was prescribed bisoprolol, which is a type of beta blocker to slow down the heart rate, to lessen the triggers that might irritate the cell membrane walls. How would your clinic treat this condition? With EDTA chelation, with the rich phospholipids that are in meat, fish, chicken, turkey, beef, eggs, yolk, so that you can repair those little injured spots, even if the C shot did it. So if she became more like a carnivore, stopped eating late, don't eat past 5 or 6 o'clock at night, your last piece goes down your throat 5 or 6 p.m. Get enough water and start an exercise program if she's able to, and move toward a more carnivore diet, and then do EDTA chelation to improve the microcirculation so her heart can improve and heal. Get someone to do her hormones, find out what her testosterone level is. The heart is a muscle, and women have woefully low testosterone levels from our lousy American diet. I'm constantly getting all my women double, triple, quadruple their testosterone levels to have strength and endurance and vitality. So that's the beginning of that. She probably needs a mineral assay to look for mineral deficiencies. She probably needs some autoimmune screen for food allergies. So many different things. Natural hormones are calming. So she can get better sleep and healing at night. So quite a few things that I would recommend. So go find a good functional doctor in your area that can start that process. Kim says, my 55-year-old husband has high potassium. He takes indomethacin, 30 milligrams, 2 times a day for reactive arthritis. He works out daily, either doing zone 2 or weight training. What would you suggest to help bring down his potassium? The first thing I would do is find out his blood type. I would need to know his age. I would find out his, creatinine. Look for CPK muscle enzymes. He needs a uric acid level done. He needs his sticky sugar, fructosamine, hemoglobin A1C, insulin, triglyceride, HDL lipid profile. He needs his fasting blood sugar on a chemistry that looks at his liver enzymes. He needs HSCRP for inflammation of his blood vessels. He needs sedimentation rate for general inflammation. He needs, depending on his blood type, he needs systemic enzymes at least to reduce inflammation, so he's not so dependent on such powerful long-term drugs like Indocin, and that's really, you're not supposed to be on that for a long time. That can, create, kidney disease. It can create ulcers, other cell membrane damaging. So he needs a good functional doctor to look at his metabolism. He might have to back off the intensity of his exercise, make sure he's drinking half his weight in pounds as water every single day, every day. And this man is critical because it's showing that his cells are getting stressed. It could be from high blood sugars unbeknown to him. He's spiking them. He needs to find out if he's insulin resistant. He needs those insulin parameters and fasting sugars done. He needs to have his male hormone to see if he's able to have enough male hormone to stimulate for the amount of workouts he's doing and the intensity of them. He certainly needs to be sure he's adequately hydrated, and maybe an extra 10% because of the volume of workout he does. So he needs to be seen by a good doctor there that will functionally look at him and see if there are autoimmune antibodies starting up, thyroid antibodies starting up, gut autoimmune antibodies. We need to do a workup on him and find out. Victoria says, how do you test for heavy metals? We do what I've done since the start of the American College for the Advancement of Medicine. I used to be on their board and taught chelation therapy to young doctors all around the world. And we do a IV of a set amount of the ethylene diamine tetracetic acid. I always use the calcium disodium EDTA. We infuse that and then collect 6 hours of urine. That's our standard because a 24-hour collection is just too cumbersome. So for decades now, we've done the 6-hour, and we can compare because we have the same exact protocol. And we send it off to doctors' data in St. Charles, Illinois. And Dr. Quigg there is been working with me for many decades on my patients. I'm one of his biggest users over the many decades now. So do a urine challenge, EDTA, urine collection for it. That's the best way. Leah says, hi, Dr. Ellithorpe. I've been doing really well with carnivore-ish diet, but was wondering why I get such indigestion when I eat hard-boiled eggs. Silly question. Also, is cheese a no? Thanks, and God bless you. Leah, I would need to know your blood type. A's have a harder time with protein digestion, and the fat, when you get it solidified in a hard-boiled egg, it's not as hard when the egg yolk is runny and so forth like that. I think this has to do with your blood type. Find out if you're a blood type A, and then use our orthodigestive enzymes from Orthomolecular, or the digestive enzymes, which is our private label, or find some good digestive enzyme with betaine hydrochloric acid in it. Lord says, did I understand that you recommend and take Juice Plus? If so, where could I purchase Juice Plus? Well, you can't purchase Juice Plus. You have to find someone who is a distributor, because Juice Plus is shared by educational trained representatives. Now, of course, if you called the clinic here at 714-544-1521 and you get the vitamin department, supplement department, they will help you get connected so that you could order it. And then be sure, if you were to order the Juice Plus, if you know of any child between the ages of 4 and college age, because you can nominate them to get on Juice Plus for free for 4 years. Because, the what is the name of the owner of creator of Juice Plus? I can't think of his name right now, but he is a teacher and he is a Christian and he loves children. And when he developed the company, NSA, National Safety Association, was all about home items to protect the family and children, like from fire. Fire alarms first came from NSA, from him. And then when he discovered Juice Plus from a naturopath, he marketed it and he wanted children to get it for free for 4 years, because he's trying out of his heart to bless the children that the Lord made. So yeah, 714-544-1521. No. Yeah. 714-544-1521 is the phone number, and we can get you linked up with someone who can help you in that vein. So let's see, do we have any new questions before I have to go? Carolyn says, sometimes I will swallow and it, what we used to say, goes down the wrong pipe, and I get a tickle and start coughing and have a hard time catching my breath. What could that be? Carolyn, the older we get, just like our skin sags on us, that same thing is happening to the structure of the voice box. Is starting to fall forward. It's not held up as tautly as it used to be. The uvula, all that stuff is starting to sag and hang down. And so the normal trajectory of swallowing and our strength of doing it is all subtly changing so that it's much easier to have what we call aspiration of our foods and liquids the older we get. Plus, we start moving more forward. Instead of doing and maintaining our exercise position, we start, looking like this, with our neck sticking out like that. And that all leads to this kind of dysphagia, trouble swallowing and aspiration. So you need to do weightlifting and exercise for posture and hold yourself up. You need to become more mindful as you're eating. The older you get, all of us do. I have to, even with my weight training, I've noticed this starting to happen to me in my 70s, but that's what it is. And then Juan says, thank you so much, Dr. E. Well, God bless you all. It's after 7. I will be back next week, 6 o'clock to 7 p.m. Ask the doctor anything. May the Lord bless and keep us all safe and all around the earth. May we be known by the love we have for one another, is what Jesus said. They'll know you by the love you have for each other. Forgiveness and mercy is what God really wanted. All right, praise the Lord. I'll see you, dear souls, next week. God bless. Bye-bye.